right? And so next, that brings us up to Jill Yersak and thinkALS, a user-friendly and comprehensive ALS diagnosis and referral tool.
Hello, I'm Jill Yersak. I'm the Vice President of Mission Strategy. Thank you to the International Alliance for having me today. I'm very happy to introduce to you a new early diagnosis guide called thinkALS. So I want to start with the thank yous. This is the most important part. We actually formed a time to diagnosis, a working group that was born out of the ALS Association's roundtable in 2020 around reducing time to diagnosis. And there it was reducing time to diagnosis really identified as an important area of improvement of ALS care and became a really high priority for the ALS Association. So I was able to form a national interdisciplinary working group comprised of ALS clinicians, people with ALS and caregivers, most importantly, pharma industry representatives, and my staff and my colleagues at the ALS Association. And so below in the acknowledgements is all the people who took part in our working group. And again, special thanks to people with ALS and their family who helped contribute to this tool. The primary authors for this tool would like to especially thank our Drs. Suma Babu, Terry Hyman Patterson, Kathy Lemon-Hirth, and Bjorn Osarkson. So as you know, time to diagnosis is a really complex problem. It can take up to a year for diagnosis, and we can do so much better. And many people go through multiple layers of clinicians before they get to an ALS specialist. Even if they do it all, sometimes they don't even get to a specialist for diagnosis. And many people undergo repetitive, unnecessary, and sometimes painful tests and procedures and surgeries during the diagnosis process. And we can do so much better. And that's the reason really behind the thinkALS early diagnosis guide. And so in our working group, which started really the discussions at the roundtable, is what are the benefits of timely diagnosis? And we learned that many neurologists, especially general neurologists, don't want to give a diagnosis or don't have the education or know what ALS is. So we put together consensus statements for the benefits of timely diagnosis that can be found here in this link. And some of the things that we identified that are listed here as benefits are access to standard of care and experimental therapies, including potential new gene targeting trials, and also a really big focus on multidisciplinary care and supportive equipment and access to them. It can allow families to prepare for extraordinary family, financial, and emotional trauma that ALS inflicts, and may reduce several unnecessary diagnosis procedures and surgeries that I had spoken about earlier that many people with ALS experience in their diagnosis journey. So the goal of the thinkALS is really to empower neurologists to identify ALS early and facilitate efficient referral process for the initial ALS clinic consultation to be completed within 2 weeks of its initial referral, and I'll talk more about that later. But really, it's here to and it's really targeted at general neurologist clinic use and to raise awareness in the non-ALS clinician community. And it's really intended to assist neurologists and advanced care providers in neurology clinics in obtaining focus history and completing high-yield exams in their really busy clinical practices and lead them to consider an ALS diagnosis earlier and provide efficient referrals that can expedite patients' first ALS clinical specialist consultation. So really get them into that, get that referral done quickly and that initial exam quickly. So this is thinkALS tool, and you can see it's a comprehensive yet simple tool describing high-yield clinical features, history, and examination pointers for suspecting ALS and ruling out other ALS mimics. And this was really, again, developed with our clinicians and through our clinicians who took special care and went through many rounds of review through the Northeast ALS Consortium and other clinicians across the country to get to this final version of the tool. So we made it easy to access this tool at this website, www.als.org/thinkALS. And you can also use the QR code in the tool. We were able to, on this website, it has all the information around thinkALS, and you're able to download it in a PDF format and print it out, and then take it to your ALS specialist or clinician for their review. So again, once a clinician suspects ALS, we recommend referral to a multidisciplinary ALS center immediately, and clearly state suspicion for ALS on the referral. And again, on the website, the tool provides lots of information, including how to find the nearest ALS center based on your zip code. So we make it easy to find for general neurologists to find an ALS specialist in their area. And even if they don't want to refer right away, they have contact information to really phone a friend and get some more information about ALS before they decide whether or not to make that referral. And so you may think, okay, why did you come up with a 2-week referral time? So in 2019, we did an annual report through our 73 US Certified Treatment Centers of Excellence. So that in that year, there's over 12,000 patients seen. And we measured the average wait time for a new patient post-diagnosis into a multidisciplinary ALS clinic. And we found that the majority of centers were able to schedule a referral within 2 weeks. I know a lot of doctors out there would be like, that's insane, I couldn't do that, but I think this is something that we would love to aim to for the future. So next is outreach and distribution. What we're doing in the next year or so to get the word out. Again, we created a website, ALS.org/thinkALS, and created a QR code. We are partnering with our care leads across the country, and we printed out copies to send them, and they're hand delivered, that they want to hand deliver to all their general neurology clinics, both community-based, private group practices, and academic tertiary care centers in their area. So they're so excited to get the word out and distribute it to centers that they want to make contact. So honestly, it's an excuse to get to know the more neurologists in their area, which is really exciting. And like I said, the Time to Diagnosis Working Group really worked hard to engage with a lot of different stakeholders from the clinician scientific community to help with feedback and improvement in the tool. And now we're in the outreach phase to help us distribute the tool. So we're working with the AAN, NEM, NEALS. We've worked with international groups, MND UK, MND Australia, and also the tools on the rare disease pages of Medscape. So thinkALS resources initiatives are obviously being presented at international conferences, just like today. So thank you again for having me and letting me spread the word. So for impact, we really hope that this can make a big impact in our community relatively quickly. We hope that we could get people into ALS clinics and specialty clinics within 2 weeks, as opposed to several months or over a year. And by simply stating clearly in the referral the following words: suspicion for ALS, the referral will enter a ALS-specific triage pool and enable prioritization, versus if you write other things like weakness or other words in your referral, you could get, which isn't specific enough, we could get into this cycle of referral that could take forever to get to the ALS specialist. So in the information on the website, thinkALS website, we tell you how exactly to write your referral. And again, for newly graduating neurology residents and fellows and advanced practice providers, we really hope this could be helpful in their busy day-to-day clinics, and really a tool for their learning that could be counted for CMA. And when we ask the patients and people with ALS and their families, like what this could help, how this could impact their lives, this is one quote from one of our community members, John Russo. He states that I was diagnosed with ALS 2.5 years after my first symptom. This being the case, I was deemed ineligible for any clinical trials that were available at the time. This was and continues to be a great disappointment for my family and me. I'm hopeful that the thinkALS tool will help reduce diagnosis times for our community, which will also allow for more time the ALS community to participate in trials. So we are also hopeful too that this could help people get into trials. And thank you, John, for providing this code and for your help developing this tool. So in the future, we really want to expand thinkALS beyond general neurologists. We started with general neurologists because that was identified in the ALS roundtable and confirmed through our working group. But we have to, because you have to start somewhere. We can't get this broad. We want to target a specific audience. But we'd like to broaden this to other audiences in the clinician realm, such as primary care, allied health professionals, and social workers, anyone who would see an ALS, ER doctors, anyone who would see an ALS person with ALS prior to diagnosis. And I really think thinkALS is one of the first of many steps in shortening ALS diagnosis time from symptom onset. And so we're really hopeful this will make a difference in shortened diagnosis times for the ALS community. And again, thank you to my Time to Diagnosis working group and the primary authors of this tool from our clinicians. Again, thank you so much for having me, and I am here to take questions. Thank you.
Thank you, Jill.
Hi, Sarah.
Hi. That is such a great tool. It's such a needed tool out there. I remember a few years ago hearing about the work they were doing in the United Kingdom with theirs, and now great work that you guys are doing and putting together here.
Yeah, thank you. When we had our working group after our roundtable, it came to the top of the list of like, what's feasible, what can we get done, and that's impactful and feasible for the community. And UK MNDA and Australia had such a great tool. It was the consensus is that, you know, we can do that for the United States. And, you know, unfortunately, the United States, its healthcare system is so fragmented versus the other two countries. So instead of focusing on primary care, like they did UK and Australia, we decided based on the information we got from the roundtable that a lot of people in the United States get stuck at general neurologists, which are a little easier to find and target a smaller population than the huge primary care network in our country. So that's why we started there versus the primary care. That said, I'm hoping, you know, after this first wave of communications, we can then reach out to allied health professionals and primary care and other groups. We had to start somewhere, essentially.
Yes, absolutely. Yes, there has to be a starting point, and
Right.
yeah, just like we were talking about something earlier today about you take the tool that was developed, but you have to make it work for your country and your situation. You can't just, a lot of times they just don't overlap like that. So, and I also think you mentioned neurology residents and getting it into the teaching programs.
Yeah, you know, when I talked to the docs on my working group, Suma and Kathy and Bjorn and Terry, you know, they kept saying, you know, these great residents and fellows, they would love to have this information. And it's good to start them early, like as they're rotating through to, you know, a lot of residents carry around these little like cards in their pockets. And you know, or having a link that they can link to, or a piece of paper that could be hanging on the wall in our clinics, they know it's there and something to look at and refer to and not feel as overwhelmed. Because, you know, ALS, as you know, ALS is a diagnosis of elimination, and the more comfortable a neurologist fellow could be thinking ALS in the first place and not being afraid to go in that direction, it would be super valuable. So I'm really hoping that we can find creative ways to get more to those fellows and residents. And, you know, if anyone in this audience has some great ideas, creative ways to do that in the United States, please let me know. I'm really open to any ideas.
Well, I don't for that, but I do like the idea of the allied health professionals as well, because the, you know, physical therapy, we do have different guides for treatment. So maybe somewhere in there we could put in guides for, you know, thinking other things. We can't diagnose, obviously, we don't have that capability, but something that would be kind of a red flag saying this might not be just carpal tunnel or lumbar stenosis. So it would have to, the tool would have to be tweaked a little, but maybe that's another idea as well.
Yeah,
Down the line.
right. Even though you can't diagnose, it doesn't matter. If you're the one who sees it and recognizes it, you can say, hey, you can flag it for the neurologist or the doctor you're working with, and go from there. And you could, just from you thinking about it, again, that's how we came up with thinkALS. It would really help just skip like multiple steps and potentially multiple unnecessary procedures, or even I've heard, you've too heard like horror stories of awful surgeries people have gone through prior to getting a diagnosis. And we can avoid all that.
Now, the other thing is, you mentioned hanging a paper on a wall.
Yeah.
Is there any thought of putting it actually into the Epic or Allscripts or one of those EMRs?
Yeah, we thought about that. It's tough. We did an informal survey with our working group and some physicians, and it's very polarizing. Some physicians love the Epic pop-up to like notify you this could be something. And then I had other physicians saying, I hate the pop-up, I ignore them, I'm so busy, I just don't even read them anymore because they're like constant on my feed, because it just keeps popping on their screen, just annoying. So I think it depends on physician personality and experience and tolerance for that. So that's one thing. And then the Epic system is huge, right? It's a behemoth. And I'm not convinced that we could do it alone. I feel like we would need to, ALS unfortunately is not prevalent enough for an Epic to take on a project like this, that we would maybe bundle it with some other neurodegenerative diseases together, so they would pay more attention and get them on they'd be more attracted for them to help us versus us going alone. I think that's doable, because I'm sure there's other diseases who would like to do this also that just haven't had the bandwidth. So maybe we can partner together with maybe like Parkinson's or Huntington's, other similar neurodegenerative diseases that are harder to diagnose. I think that would be more doable. Just thinking about, again, feasibility. Would they actually even pay attention to us in the first place?
Right. But bringing everyone together, maybe then yes, they would.
Yeah.
Now this is available right now. It's out there.
It's out. So it's on. If you go to our website or just Google thinkALS, all one word, it'll take you to our website, and then it has all the resources I talked about in the video around how to find a multidisciplinary clinic or ALS specialist in your area. And then there's a benefits to timely diagnosis consensus statement, and you can download the tool right from there. And then there's a QR code. If you print it, if it's in your office, you can just use a QR code and download from there. But I love holding paper still. I hate reading things online. I have glasses now because I can't see anything online.
Did you just describe me? Thank you.
Yeah, see, that's just me. I'd rather hold a piece of paper and give it to me and read it that way. So, and plus people learn differently. Some people are more visual than others. So I think all the different ways that you can download, print it out, or just looking at online could help.
Okay.
The hope anyway.
Well, then we want, and somebody comment on this, we want an update in a year from now to see who's using it, how many people are using it, see if it's made a difference, because absolutely we need to move that time clock back so that people are diagnosed sooner, so they can have access to clinical trials and get into multidisciplinary clinics sooner. Absolutely. I think it's a fabulous tool. Thank you so much for the work that you and that whole group have done.
Thank you. We had a really great working group. Suma and Terry and Bjorn and Kathy were awesome. And then we had people with ALS on and caregivers, and some really great industry sponsors who contribute. It was a fun project that, now we're in the rollout phase and we're trying to get creative how to get it out. And we're also thinking of creative ways how to measure if people are actually using it through our certified treatment center reports. And if you go online, you'll see you have to like write your name in to download it. The reason why we do that is so we can track if people are actually downloading it or not.
Mhm.
So we're not trying to, it's not a barrier, it's just there so we know people are using it. So we're just trying again to give ways to figure out if people are how many people are using it.
All right. Well, thank you so much.
Thank you, Sarah. Thank you for having me. It's so nice to see you. I hope to see you soon in Philadelphia, okay?
Yes, absolutely. Great to see you.
Take care.